21. Case study, hyperglycemia. Patient information. 60-year-old male with type 2 diabetes reports frequent urination and excessive thirst. Current blood glucose, 320 milligrams per deciliter. Question: what is the nurse's priority intervention? Answer: administer insulin as prescribed. Monitor for signs of ketoacidosis and assess fluid status. 22. Case study, infection control. Patient information. 45-year-old female with a wound infection presents with redness and purulent drainage at the site. Vital signs: BP 125/80 mmHg, HR 85 bpm, temp 38.2 degrees Celsius, 100.8 degrees Fahrenheit. Question: what is the nurse's priority action? Answer: perform wound care as prescribed and maintain strict aseptic technique. Notify the healthcare provider and monitor for systemic signs of infection. 23. Case study, renal failure. Patient information. 65-year-old male with chronic kidney disease presents with decreased urine output and swelling. Vital signs: BP 150/85 mmHg, heart rate 88 bpm, RR 20 breaths per minute. Recent labs: creatinine 4.2 milligrams per deciliter, BUN 60 milligrams per deciliter. Question: what is the nurse's priority intervention? Answer: prepare the patient for dialysis as prescribed. Monitor fluid and electrolyte balance closely. 24. Case study, preeclampsia. Patient information. 32-year-old female, 36 weeks pregnant, presents with headache and visual disturbances. Vital signs: BP 160/100 mmHg, HR 85 bpm. Urinalysis: proteinuria present. Question: what is the nurse's priority intervention? Answer: administer antihypertensive medication as prescribed. Monitor for signs of eclampsia and prepare for possible emergency delivery. 25. Case study, diabetic ketoacidosis, DKA. Patient information. 18-year-old female with type 1 diabetes presents with fruity breath and deep, rapid breathing. Vital signs: BP 90/60 millimeter of mercury, HR 110 bpm, RR 28 breaths per minute, SpO2 93% on room air. Current blood glucose 450 milligrams per deciliter. Question: what is the nurse's first action? Answer: administer for insulin as prescribed. Monitor potassium levels and fluid status closely. 26. Case study, neutropenia. Patient information. 60-year-old female receiving chemotherapy presents with fever and sore throat. Vital signs: BP 110/70 mmHg, HR 90 bpm, temp 38.5 degrees Celsius, 101.3 degrees Fahrenheit. Recent labs: WBC 1 200/mm superscript 3. Question: what is the nurse's priority action? Answer: administer antibiotics as prescribed and place the patient in protective isolation. Monitor for signs of infection and notify the healthcare provider. 27. Case study, pediatric dehydration. Patient information. 2-year-old female presents with sunken eyes and decreased urine output. Vital signs: BP 80/50 millimeter of mercury, HR 140 bpm, temp 37.8 degrees Celsius, 100.0 degrees Fahrenheit. Question: what is the nurse's priority intervention? Answer: administer oral rehydration solution or 4 fluids as prescribed. Monitor for improvement in hydration status and urine output. 28. Case study, thyroid storm. Patient information. 45-year-old female with hyperthyroidism presents with palpitations, fever, and confusion. Vital signs: BP 160/90 mmHg, HR 130 bpm, temp 39.0 degrees Celsius, 102.2 degrees Fahrenheit. Question: what is the nurse's priority intervention? Answer: administer beta blockers and antithyroid medication as prescribed. Monitor for improvement in symptoms and notify the healthcare provider. 29. Case study, pulmonary embolism. Patient information. 60-year-old male, post-op day 2 from knee replacement surgery, reports sudden shortness of breath. Vital signs. BP 100/60 mmHg. HR 120 bpm. RR 28 breaths per minute. SpO2 88% on room air. Question: what should the nurse do first? Answer: administer oxygen and notify the healthcare provider immediately. Prepare for diagnostic tests such as a CT scan to confirm the diagnosis. 30. Case study, diarrhea in an older adult. Patient information. 75-year-old female, reports frequent, loose stools and abdominal cramps. Vital signs. BP 100/60 mmHg. HR 95 bpm. Temp 37.2 degrees Celsius, 99.0 degrees Fahrenheit. Question: what is the nurse's priority assessment? Answer: assess for signs of dehydration and electrolyte imbalance. Obtain a stool sample for culture if ordered. 31. Case study, acute pancreatitis. Patient information. 50-year-old male presents with severe abdominal pain radiating to the back. Vital signs. BP 140/90 mmHg. HR 100 bpm. RR 22 breaths per minute. Temp 37.8 degrees Celsius, 100.0 degrees Fahrenheit. Question: what is the nurse's priority intervention? Answer: administer pain medication as prescribed and place the patient in a position of comfort. Monitor for signs of complications, such as hypovolemia or infection. 32. Case study, hyponatremia. Patient information. 65-year-old female, presents with confusion and muscle cramps. Recent labs. Sodium 120 milliequivalent/L. Question: what is the nurse's priority intervention? Answer: administer prescribed hypertonic saline solution slowly. Monitor for signs of neurological improvement and notify the healthcare provider. Answer: prepare the patient for dialysis as prescribed. Monitor fluid and electrolyte balance closely. 33. Case study, suicidal ideation. Patient information. 30-year-old male, presents with depression and reports thoughts of self-harm. Vital signs. BP 120/70 mmHg. HR 80 bpm. RR 18 breaths per minute. Question: what is the nurse's priority action? Answer: administer antihypertensive medication as prescribed. Monitor for signs of eclampsia and prepare for possible emergency delivery. 34. Case study, anemia. Patient information. 50-year-old female with a history of heavy menstrual periods, presents with fatigue and pallor. Recent labs. Hemoglobin 8G/DL. Question: what is the nurse's priority intervention? Answer: administer prescribed iron supplements and monitor hemoglobin levels. Educate the patient on dietary sources of iron and follow-up care. 35. Case study, septic shock. Patient information. 60-year-old male with a history of diabetes, presents with confusion, low urine output, and fever. Vital signs. BP 85/50 millimeter of mercury. HR 120 bpm. Temp 39.2 degrees Celsius, 102.6 degrees Fahrenheit. Question: what is the nurse's priority intervention? Answer: administer 4 fluids and vasopressors as prescribed. Notify the healthcare provider immediately and prepare for possible transfer to the ICU. 36. Case study, pressure ulcer prevention. Patient information. 85-year-old female, bedridden with limited mobility, at risk for pressure ulcers. Vital signs. BP 130/80 mmHg. HR 78 bpm. RR 16 breaths per minute. Question: what is the nurse's priority intervention? Answer: implement a turning schedule and use pressure-relieving devices. Assess skin integrity regularly and apply protective barrier creams as needed. 37. Case study, post-op nausea. Patient information. 40-year-old female, post-op day 1 from abdominal surgery, reports nausea. Vital signs. BP 110/70 mmHg. HR 76 bpm. RR 18 breaths per minute. Question. What is the nurse's priority intervention? Answer. Administer antiemetics as prescribed and assess for nausea relief. Encourage slow, deep breathing and provide a cool cloth for comfort. 38. Case study, geriatric delirium. Patient information. 82-year-old male, presents with sudden confusion and agitation. Vital signs. BP 140/85 mmHg. HR 90 bpm. RR 20 breaths per minute. Question. What is the nurse's priority assessment? Answer. Assess for underlying causes such as infection, dehydration, or medication effects. Provide a calm environment and reorient the patient frequently. 39. Case study, asthma management. Patient information. 25-year-old female with asthma, presents with wheezing and difficulty breathing. Vital signs. BP 120/80 mmHg. HR 100 bpm. RR 24 breaths per minute. SpO2 92% on room air. Question. What is the nurse's first action? 40. Case study, hypothermia. Patient information. 70-year-old male, found outside in cold weather, presents with shivering and confusion. Vital signs. BP 110/70 mmHg. HR 60 bpm. Temp 35.0 degrees Celsius 95.0 degrees Fahrenheit. Question. What is the nurse's priority intervention? Answer. Remove wet clothing and provide warm blankets. Monitor vital signs and core temperature closely and notify the healthcare provider.